when I had an interaction with my friends in America, they were very angry that we are still removing breasts in Africa.
It's my pleasure to introduce my guest. His name is Dr. Esteem Tatar. Dr. Esteem Tatar is a consultant general surgeon and a lecturer in the Department of Surgery at Ambrose Ali University, Ekpoma, Edo State. A researcher with a remarkable track record in surgical practice and education. Now, with his vast experience spanning general surgery, surgical oncology, hepatobiliary and endocrine surgery, as well as pediatric surgery, Dr. Tagar has served as consultant general surgeon at ERA Specialist Teaching Hospital. He's a passionate educator. He's a mentor that is shaping the next generation of surgeons as a lecturer at Ambrose Ali University. Dr. Esteem Tagar. Chief, good evening, sir.
Thank you very much, Dr. Fred. Good to be here once again.
How has it been managing patients with breast cancer in this part of the world?
Well, like you said, it was traumatizing to you. It's always been like that in the Sub Saharan Africa. The management of breast cancer has been challenging, and the reason why it's been so is because of the late presentation of breast cancer in our environment. Even though
Mm.
breast cancer is very rampant worldwide,
Mm-hmm.
the cases in the Sub-Saharan Africa, in particular, that is the region you usually see those ones that are presenting very late. And usually the outcome of breast cancer depends on the stage of presentation. If the patient is presenting very early, we expect a favorable outcome wherein we expect the patient to be cured. But when
Mm.
they present late, at that point in time, the aim of management or the aim of treatment is just palliative, where you just manage the symptom and hope for the patient to still live for some period of time. Okay, but in the sub-Saharan Africa, the presentation is quite late, and they present with advanced breast cancers,
Mm.
which makes their management to be challenging. And over time, we've been able to see some reasons why these patients present late. And one of the reasons is, should I say, ignorance? Okay, because most of these patients, they tend to present to prayer houses, spiritual healers, tradomedical practitioners, and all that when they notice breast symptoms. And by the time they are coming to the hospital, the disease is quite advanced. And at that point in time, anything curative is out of it. Okay, then some of these patients too, they present late because of the fear of mastectomy.
Mm.
Some of them feel that once you have breast cancer and you come to the hospital, you'll be offered mastectomy. Mastectomy is a medical word for the removal of the breast, a total removal of the breast. All right, but that is not true. Okay, the truth of the matter is, when you present very early, there are options for the treatment of breast cancer, and one of the options is breast conserving surgery. Okay, but why our rates of mastectomy is high in this environment is because of the late presentation, because the stage at which they present to our hospitals, is quite late, and they present with advanced disease, so we won't be able to actually do breast conserving surgeries for them. And because of the fear of mastectomy, some of them will also decide not to come to the hospital, and by the time they eventually come to the hospital, it's quite advanced. So this
Mm.
is really the challenge that we face in this region. But
Mm.
in the developed countries, they tend to present early. Okay, and those patients, most of the times they offer them breast conserving surgery, wherein they remove just part of the breast where the cancer is, and still leave the remaining part of the
The
breast
rest.
behind. Okay, so but that procedure, we don't is not routine in our environment because of the late presentation. And another thing that lead to late presentation in our environment is the lack of screening facilities in our environment. Okay, in the developed countries, most of the patients there, they go to the hospitals, they do breast cancer screening test and the rest. But in our environment, advocacy is not quite impressive here. Okay, and because of that, most of our patients are not aware of the disease. So because of the poor awareness, most of them, it contributes to their presentation late, because if it's only when you know about the existence of a particular disease or how the
Mm.
disease presents, that you need to come over to the hospital to see the doctor. But where the awareness is lacking, most of the patients will not really present to the hospital. And because of this poor awareness of breast cancer, our patients will also present late to the hospital. And the late presentation means they will present with an advanced disease, okay,
Hmm.
which means that for those patients to achieve cure becomes very difficult. And at the end of the day, they may still end up with mastectomy, which will also still instill fear in the minds of other ladies out there. So these are
Yeah.
basically the challenges we face in managing breast cancer in our environment.
Thank you for this um, summary of the whole issues surrounding breast cancer. But there's something you mentioned that struck me about not being aware. In this present day time with social media, you can get almost any information you seek right now. It's challenging to know that some people still don't even know what breast cancer is. So I want you to help us break it down, sir. What really is this breast cancer?
All right. So first and foremost, I think I should just say what breast cancer is. So breast cancer is when you have some abnormal cells in the breast growing out of control.
Hmm.
Abnormal cells in the breast growing out of control. That is what you see in breast cancer. And once they start growing out of control, there is a tendency for them to spread to other parts of the body.
Hmm.
Okay, like I've said previously, breast cancer is very rampant worldwide. And
Okay.
in Nigeria and other parts of Africa, the prevalence and incidence of breast cancer is still very, very high, right? Then most of the time, we tend to see it as a disease of women, but it can actually occur in males. Though the prevalence in males is quite reduced compared to females. Out of every 100 breast cancer patients that we see in our clinics, I can always tell you that 99 are females, while only one will be male out of every 100. That is to tell you that the rate of breast cancer among males is about 0.5 to 1%. So you can almost always say that it's a disease of ladies, but a man can also come down with breast cancer. So we as men, we are not totally free from breast cancer. Then
Hmm.
the factors that make one to be at risk of breast cancer, there are many. So I'll just mention some. The first is gender, like I've
Okay.
said before, that is commoner among the females. All right. So being a female alone is a risk factor for breast cancer. All right. Then another thing is age. Okay. So breast cancer is commoner among the older females. But that does not mean the younger females cannot come down with breast cancer. Breast cancer can actually occur at any age after puberty, right? So, which means that a 20-year-old girl can actually come down with breast cancer. In fact, I've managed several girls with breast cancer that were below 25 years of age, all right? But the incidence is actually more as one grows older. Then the next thing is family history. Breast cancer is one of the hereditary diseases as it tends to run in some families, which means that if a particular member of the family has had breast cancer before, chances become very high that another member of the family can come down with breast cancer. That is to say, breast cancer can actually run in some families. And this most times is due to some genetic predisposition. By the time you have some genetic problem in the family, then breast cancer becomes a problem that can easily be inherited in that family. For instance, there is a superstar, an actor in the US, in Hollywood, that had a family history of breast cancer at a time ago. And she, because of awareness, which was why I said awareness is lacking in this part of the world. She was well aware of breast cancer, and knowing that a family history of breast cancer makes one predisposed to breast cancer, having breast cancer. She went to her doctors for screening, all right. And they actually did a genetic testing for her and discovered that she had this genetic predisposition for breast cancer. She actually had a genetic mutation. And because of this, she was offered what we call a prophylactic mastectomy, which means she had her breast removed, Because even in the Bible, if you look at the book of Matthew, chapter 5, verse 29, Jesus Christ said, if a part of your body, the eye in particular, if your eye is going to cause you some problems, you should pluck it out. All right. So if one of your breasts is going to cause you problem, it's going to take your life, I think you can take it out, which was what the lady did. They offered her prophylactic mastectomy. Both breasts were removed, and the breast reconstruction was done for her. Today, she's alive. She's well today. All right. So that is a genetic predisposition to breast cancer. So a family history of breast cancer is a very, very strong risk factor for breast cancer. Another risk factor is the reproductive risk factor. When we talk of reproductive risk factor, it means there are events in the patient's reproductive life that may make them to be, prone to having breast cancer. And the reproductive life of a female starts from when the female starts seeing her period, which is what we call menarche, and it actually ends when the female stops seeing her period, which is what we call menopause in medicine. All right. So there are some key events that may take place in the patient's reproductive life that may make the patient to be predisposed to having breast cancer. So one of them is what we call early menarche, which means when a female sees her first menses earlier than normal, chances are high that she will be at risk of having breast cancer.
Okay.
The normal time for a girl to start seeing her period is from 12 years. So when you see a girl seeing her first period earlier than 12 years, say for example 10 years, 11 years, we say that is early menarche. And once they start seeing their period very early like this, they will be exposed to a hormone called estrogen. And this estrogen is the hormone that has actually been implicated as one of the risk
Of
factors
course, yeah.
for breast cancer. So once there is a prolonged, what we call a prolonged unopposed exposure to estrogen, so any factor that will make the lady to be exposed to estrogen for a prolonged duration of time will make that lady to be at risk of breast cancer. So seeing the very first period before the age of 12 years, which we call early menarche, is a risk factor. All right. Then again, the age at which the lady gives birth to her first child is still very important.
Hmm.
We advocate that ladies should try as much as possible to give birth to their first child before they clock 30 years. Because if you are giving birth to your first child after the age of 30, the risk of breast cancer increases in such ladies. So that's why at times we advocate that ladies should get married on time and give birth to their first child before they are 30 years of age.
Hmm.
Also, the duration of breastfeeding is also another risk factor. For those ladies that breastfeed for a prolonged period of time, they are
Mm-hmm.
protected from breast cancer. So, what we advise is that breastfeeding should at least last for a period of 18 months. Okay, so we encourage patients to breastfeed. We encourage ladies to breastfeed for a period of 18 months to 2 years. This is protective. And for those working class ladies, for example, that will breastfeed for just 3 months, 4 months, and resort to use of formula feed alone, those ladies are at risk of developing breast cancer because of
Hmm.
that short duration of breastfeeding. Prolonged duration of breastfeeding actually protects, the ladies from breast cancer. Then another thing that makes ladies to be at risk of having breast cancer is what we call nulliparity. Nulliparity is a nulliparous lady is a lady that is yet to give birth to a child. So for those ladies that live their lives without giving birth to a child, they have a higher risk of having breast cancer. This is why most times we have a high risk of breast cancer among the nuns because
Hmm.
those people they don't give birth. All right. While
Hmm.
multiparity is actually protective. Multiparity means giving birth to number giving birth to children. All right, several children, for example, we call those patients that have given birth to several children multiparous women because they've given birth to several children. And multiparity protects against breast cancer. Why nulliparity? is a predisposing factor to having breast cancer. Then the age at which a lady attains menopause is also very critical. All right, menopause is the cessation of menses, and most times after the age of 45, we expect menopause to set in. And if a lady is still seeing her period after the age of 55 years, we say that lady is experiencing a late menopause. And it means that that lady will be exposed to estrogen for a prolonged duration of time. Because if the lady has attained menopause at 45 years of age, that will be a cutoff of estrogen from that lady's life. But if she's
Yeah.
still seeing her period at 50, 55, it means there will be a prolonged exposure, and
Exposure.
that will predispose that lady to having breast
Breast.
cancer. Aside these reproductive, okay, aside these hormonal factors, there are other, these hormonal factors I've just mentioned are actually the hormones that the body generates. Okay,
Mm-hmm.
so there are still other hormones that the lady takes. All right. The lady uses this hormone. Some they don't even know that they are using hormones. For example, ladies that are using oral contraceptive pills, there's still
Mm.
estrogen in some of these oral contraceptive pills. So it's
Mm.
like deliberately taking this estrogen, which we know can actually make the lady to be prone to having breast cancer. So for those
Mm.
ladies that take oral contraceptive pills to prevent pregnancy, for example, they are taking a lot
Mm-hmm.
of estrogen. I'm not saying
Mm.
contraception is bad, but
Okay.
there are so many contraceptions that ladies can use. So at least they can discuss with their doctors to know the best, plan for their contraception instead of just relying on the hormonal oral contraceptive pills, which we know that they predispose some ladies to having breast cancer. Then even some ladies after menopause, they may start to experience some funny sensations in their body because the estrogen as it is helps to smoothing, cause some make them to feel like young ladies, for example. But by the time they attain menopause, the estrogen is cut off, and that feeling
Yeah.
of being young is no longer there.
Yeah.
And some of them start to experience some body heat, what we know as hot flushes. Some will have dryness of the vagina. Some will be having
Mm.
bone
Mm.
that. Because of this feeling they are beginning to have at menopause, some may want to take some exogenous estrogen. They will want to take this hormone as a form of therapy, which we
To help
know
them.
as a hormone
Mm.
replacement therapy to help them in this
Yes.
resolve some of these conditions. While they are taking this hormone, they don't know that it's doing more harm to them than good.
Mm.
So this exogenous hormone may actually make them to be predisposed to having breast cancer. So if you look
Breast
at
cancer.
factors, basically these reproductive factors, basically you know that some of them are actually modifiable while others are not modifiable. When I say modifiable, it means there are some that you as a lady you can actually alter their course, while others they are not in control of them. For example, the age at which you see your first period, you are not in control of it. So you cannot tell yourself that I want to make sure I get to 13, 14 years before I see my first period so that I will be protected from having breast cancer. So we say that this one is not modifiable. All right.
Mm-hmm.
Then age at which you give birth to your first child, to some extent you can modify it. For example, if you decide to get married on time and give birth to your first child before the age of 30, you'll be dodging a bullet. All
Hmm.
right. If you still decide that you want to take your time, you want to live your life before getting married later and giving birth later, you understand? So you live till 35 years, for example, before you give birth to your first child. This is the one that is within your control that basically you refuse to control. So if you now give birth to your first child after the age of 30, you are at risk of having breast cancer. All right. Okay, then the age at which breastfeeding also is still within your control. You can decide that you want to breastfeed each of your child for a period of 18 months to 2 years, for example, which is
Hmm.
protect. Okay, but if you still decide that you just want to breastfeed your child or your children for a period of a month, 2 months, 3 months, you are doing more harm to yourself. This is within your control. But if you decide to now, throw it away, is a way that you could have used to actually prevent breast cancer. All right. Then the age at which you attain menopause is not within your control. You cannot tell yourself that I want to attain menopause at 40 years so that I will be protected from breast cancer. If God says you are still going to be seeing your period at the age of 55, then you still be seeing your period there. That one is not modifiable, it's not within your control. Then the use of those other medications, for example, estrogen containing oral contraceptive pills, and the use of the hormone replacement therapy that I explained before now, those ones are within your control. You can choose not to use oral contraceptive pills. You can choose other forms of contraception, for example. These are within your control. These are the reproductive risk factors. Then we also have other risk factors that have to do with lifestyle, as we mentioned earlier. All right. So living sedentary lifestyle, lack of exercise, for example, can actually make someone to be predisposed to having breast cancer, because obesity, as it is a very strong risk factor for having breast cancer. All right. Then alcohol consumption is also a risk factor for breast cancer, just like cigarette smoking. Okay, so these are some other risk factors for. There are several risk factors like that for having breast cancer, but I still want to mention that in the patients that we have seen from studies, half of the
Mhm.
patients with breast cancer, you may not actually see any risk factors. So it doesn't mean that once there is the presence of a risk factor, that patient must come down with breast cancer. We have seen a lot of patients that have breast cancer that we could not trace any risk factors. Then we've also seen patients with risk factors for breast cancer that did not come down with breast cancer. Okay, so this is just kind of creating an awareness so that you get used to some of these risk factors, and the ones that you'll be able to avoid, you should be able to avoid them. The fact that some patients have risk factors and did not come down with breast cancer does not mean if you have the risk factors, you will not come down with breast cancer. All right. So
Yeah.
basically, these are some of the risk factors that may make patients to be prone or predisposed to having breast cancer.
Almost everybody listening might have one point in their life come across or heard somebody or know somebody who came down with breast cancer. And I've had conversations, especially on social media. People now say breast cancer is now common, that in the olden days, there's nothing like breast. I don't know, sir, if you've also heard things like that. People say now we now have so much breast cancer, but in the olden days, there was nothing like that. How true is this statement?
Okay, now I don't think it's very correct. It may also
Okay.
be correct. All right. It may be correct in the sense that in the olden days, there are some of these things that we do now that our mothers then, our grandmothers were not doing. For
Yeah.
example, the lifestyle, some of our ladies now drinks a lot of alcohol, smoke cigarettes,
Mm,
and the rest things. These were not habits that our parents and grandparents were known for.
yeah.
Okay. Also, the reproductive lifestyle was quite different then. Then we used to
True.
see our mothers, grandmothers at 20, 21, 22, they get married and they start giving birth to
Giving
children.
birth.
But now you
Yes.
see some of the working class ladies, they will stay, have master's degree, have a PhD before wanting to get married. At the end of the day, they get married at 33, 34 years and will give birth to their first child at 35, 36 years, which is
Mm,
risk factor, which is,
true.
these are some of the risk factors. Then in the olden days too, you see ladies breastfeed their children for about 2 years. But now most of our ladies are they are career ladies. They don't have the luxury of time to breastfeed their children for that long. Some of them will just breastfeed for 3 months, for 4 months, and that is it. Okay. So these are factors that ordinarily would have protected them from having breast cancer, but they don't have the time to actually modify these factors to benefit to their own benefit. So some of the ladies of old, our parents, grandparents, and all that, these were some of the factors that they some of the things that they were doing there that may have protected them from having breast cancer. But the ladies of this generation, they don't pay attention to some of these things. Another thing too is that now, I think to some extent we are testing for breast cancer. Okay. Before now, some ladies may die for breast cancer without even knowing that it was breast cancer. Some will tell you that it was an affliction, it was an arrow that was thrown at them.
Mm,
Okay, a witch confessed somewhere that he or she afflicted so person, and the person died from the condition, not knowing that the condition that they are confessing to, or they are saying the patient died from, was actually breast cancer. So to some extent, testing there was not as much as it is today. So now maybe I think we're diagnosing breast cancer now, but that was not the case before now. Okay, I've seen
Mm.
patients before. I'll ask them, do you have any family history of breast cancer? They will tell me no, that they don't. But their grandmother, for example, had a problem with the breast as they were told, but she did not go to the hospital. So a diagnosis of breast cancer was not made. So I will say that the rate at which they were making diagnosis there was quite low compared to now that we now have the technology to make diagnosis. Okay, so some of them may have had breast cancer back then without knowing that they had breast cancer.
Breast cancer,
But now,
true.
to some extent,
We
the
can now
ladies
make the
are
diagnosis.
aware, they come to the hospital and will not make diagnosis. So if someone has breast cancer, at least they will know that they have breast cancer compared to the time of old that they will have breast cancer without knowing that they have breast cancer.
If you are watching and you haven't subscribed, you haven't followed, click on the follow button so that you don't miss very important information like this. I want to ask, I've heard comments like this as well that says any problem with your breast is breast cancer. And that is why most ladies are now scared. So when a lady say, I have a pain, or there is a change in color of my breast, it's breast cancer. And it makes some ladies scared to present at the hospital. So I want you to help us break it. It's every breast problem, breast cancer. And what are those things to look out for, or what a lady would see on her breast that might point towards breast cancer?
All right, so first and foremost, before I answer that question, I want to, just throw some light on breast cancer screening. You know, it's always good that you take care of your breast,
Mm-hmm.
you examine your breast, because
Mm-hmm.
it's when you are aware that there is something called breast cancer, that there may be something in your breast, that you will come to the hospital that there's something in your breast. If you are not aware, there are some patients that may have something in their breast for about 2 years before coming to the hospital. All right. So that's why I said the awareness in our environment is still lacking to some extent when compared to the developed countries. Okay. So the rate of screening is still quite low in our environment, which is responsible for the late presentation to the hospital. Now, there
Mm.
are various ways that we can actually conduct breast cancer screening. The simplest of them is what we call breast self examination, which is something that we need to educate our ladies on. They need to know how to examine their breast on their own. And breast self examination entails the lady examining her own breast. And this is usually done once every month. And we advise every lady that has attained puberty to start breast self-examination. Once you are once you've reached the age of 18 years, 20 years, you should ideally start breast self-examination. When should you do this breast self-examination? We encourage ladies to do it like 3 to 5 days after the end of their period every month. At this point in time, their breast is less tender, it's not really painful, and it's less lumpy. So if there is anything in the breast, they can easily identify it. And how do they do breast self-examination? We encourage that they stand in front of the mirror, look at their breast. They should look at the colors of their breast. They should look
Mm-hmm.
at the size of their breast. Is one appearing bigger than the other? All right. Is there a problem with the coloration of the skin of the breast? Is it having dark discoloration? Is there a problem with the nipple? Is the nipple retracting inwardly? These are some things that they can see when they look at their breast in the mirror. They will also advise that they should palpate the breast. When I say palpate the breast, they should actually use the palms of their hand to feel the breast. All right, feel it against their chest wall to see if there is any swelling in the breast. They should feel the right breast very well, feel the left breast very well, and they should also feel their armpit too to see if there's any problem. This is something they should be doing every month, 3 to 5 days after the end of their period, every month of their life. All right, so that once they notice anything, they can easily come to the hospital. And when they come to the hospital, we do what we call the clinical breast examination. Okay, so wherein the doctor will now examine the breast to see if actually there is anything in the breast. And for those patients that have a family history of breast cancer, we even advise that they just come straight to the hospital for us to screen them. So when we examine the breast, if the breast is suspicious, if we are suspecting that there may be something in the breast that is not clear, then we can actually carry out for that screening using some imaging technology. We can ask the patient to do an ultrasound scan if it's a young girl, or a mammogram if it's a lady that is above 35, 40 years of age. And once we see something suspicious, then we can take the next step, which is making diagnosis. Now, for the symptoms that they may come down with, if you notice something in your breast, what are the symptoms that may suggest that there is breast cancer in this patient? Firstly,
Yes.
I would say that there are times that a patient may even have breast cancer without having any symptom, which
Mm.
means that
Mm.
breast
Mm.
cancer can be asymptomatic. When we say
Mm.
something is asymptomatic in medicine, means there is no symptom.
Mm.
Okay, so you may have breast. The fact that there is nothing in your breast does not mean there is no cancer
Mm.
there. After all, cancer
Mm.
starts growing insidiously, starts growing slowly, and
Yeah.
over time it will start to manifest. So that is why we are actually advocating for breast cancer screening. All right.
Mm.
So once you get to, for example, you've been doing breast self examination and you get to 40 years of age, for example,
Mm-hmm.
please submit yourself for a thorough breast cancer screening using a mammogram. All right. If there is something that is hiding in the breast that you cannot see, that has not grown big enough for you to identify, for example, if we do a mammogram for you, we'll be able to pick it. And these are the things that can actually lead to early detection of breast cancer, which means that by the time we are detecting it, the breast cancer is still at the early stage, wherein even if you want to do a surgery for you, it will not entail removing the entire breast. We can just remove only the cancer because we are detecting it very early. But for those ones that we present with symptoms, what are the symptoms that you may likely see that may
Yes.
suggest breast cancer?
Okay.
What are the symptoms? All right. So the commonest of them is a lump in the breast. You notice a lump in the breast or a swelling in the breast. And once there is a swelling in the breast, for those that do breast self examination, it's very easy for them to pick the swelling as early as possible. All right. So if you are doing breast examination and you notice a lump in your breast, chances are very high that if it turns out to be cancer, it's going to be at this early stage because you've been
Okay.
examining your breast and you notice the lump as at the time is just developing. All
Developing.
right. So most times too, it's not every lump that is cancer.
Okay. Okay.
For example, in the young ladies, when they have lump, majority of the lumps in the young ladies are not cancerous lumps.
Mm.
Okay, some of them have what we call, if a swelling is not cancer in medicine, we say it's a benign swelling, which means it's a non-cancerous swelling. Most of the lumps in young ladies are not cancerous. All right, but that does not mean a cancerous lump cannot grow in a young lady. I've said it before that I've managed several ladies with breast cancer that were below the age of 25 years. I've managed a lady of 18 years old with breast cancer before. All
Mm.
right. But majority of the young ladies that have a lump in their breast, those lumps are not cancerous. But it will take only a doctor to tell you that the lump is not cancerous,
It's not
which
cancerous.
means even as a lady of 18 years old, 18
Yes.
years old, if you experience a lump in your breast, please come to the hospital. That lump must come out. We will take the lump out and send it to the lab for a test. It's only after testing it in the laboratory that we can confidently tell you that this lump that we remove from your breast is an ordinary lump, is not a cancerous lump. Okay? Without removing that lump for a test, we cannot tell you that it's an ordinary lump or it's a cancerous lump. So any lump in the breast, we advise should come out. So once you notice any lump in the breast, being it a lady of 18 years old, 20 years old, 30 years old, please come to the hospital for us to remove that lump and test that lump to know what it is. Okay? But when we now notice a lump in a middle aged lady, for example, a lady that is above 40 years of age,
Mm.
chances are high that that lump is cancerous.
Mm.
Okay, every lump we see in a middle-aged lady, for example, or an elderly lady, for example,
Mm.
an elderly lady comes to my clinic, a lady of 65, 68 years old comes to my clinic
Mhm.
with a breast lump. The first thing that comes to my mind is cancer before any other thing. So that is why I said at the beginning that age is very important and that
Mm.
breast cancer are commoner amongst the older ladies than the young ladies. So another thing too is that Some ladies, there is a tendency for some ladies to think that when they have a lump that is painful, that is when it will be breast cancer. No, that is not true. That is
Mm.
misconception. Most breast cancers are painless. Okay, so the lump that you should be scared of is the one that is painless.
Mm.
So once you see a middle-aged lady, an elderly lady that has a swelling in the breast, a painless swelling in the breast, you should be scared of that swelling. Okay, but if the swelling is painful at times, we are not too worried that this is going to be cancer. Most times, cancers are painless. Okay, that does not mean some may not be painful. Some that are already advanced may be painful, but generally speaking, when you have a cancerous growth in your breast, it does not present with pain. It's a painless lump in the breast. Okay, so let's get that straight so that when a lady that is advanced in age experiences a swelling in her breast that is painless, is a worrisome swelling, and such a lady should come to the hospital. Then another thing too is there may be some form of a change in the color of the breast. You may notice that the breast now appears like the peel of an orange, the back of an orange. That is worrisome. When you see a lady's breast has the appearance of an orange peel or the
Mm-hmm.
back of an orange, all right, you see those depressions you see in oranges in a lady's
Mm-hmm.
breast, that is highly suggestive of breast cancer. And when you see that, that is why it's not all the time that you see a swelling in the breast. Just that orange, the appearance of
Appearance.
the back of the orange in the breast alone is highly
Yeah.
suggestive of the breast cancer. And when you see that one of your breasts is bigger than another breast, even though there are some ladies that physiologically have one breast bigger than the other, when if both breasts have been equal and suddenly you now notice that one is now getting bigger than the other one, you should be worried and come to the hospital. Then look at the nipple very well too. Some patients with breast cancer, they may not experience any lump. What they will just experience is that the nipple is now retracting inwardly. Okay, so once you see that there is some form of nipple retraction, is a sign of breast cancer.
Mm.
And such
Mm.
a person should come straight to the hospital. Then also, nipple discharge is another worrying sign. Okay, there are various forms of nipple discharge. And when you come to the hospital, for example, with nipple discharge, we can easily tell you that this nipple discharge may be the one that is resulting from cancer or the one that is not resulting from cancer. But when we really get worried is that when we start seeing bloody nipple discharge, okay, in a patient that is in her 30s, 40s, 50s, 60s. But when we see bloody nipple discharge in patients that are less than 30, for example, we may not be that worried because there are other conditions that can cause bloody nipple discharge in ladies that are less than 30 years. But by the time we are seeing bloody nipple discharge in ladies that are above 35 years of age, we are really worried because breast cancer is one of those diseases that present with bloody nipple discharge. So these are some of the things that breast cancer may present with. Then let me also mention that there are times that the patient may present at an advanced stage. Like I
Mm-hmm.
mentioned at the beginning, breast cancer can easily spread. Even there are times that at the time you are noticing that there's something in your breast, it might have spread to other parts of the body. The breast cancer can actually spread to any part of the body. It can spread to the lungs, it can spread to the brain, it can spread to the spinal cord, it can spread to the liver. Okay, some people may actually come to the hospital with symptoms of those parts of the body that the breast cancer has spread to. For example, if it has spread to the brain, they may come to the hospital with convulsion, and you
Mm.
will think that the patient has a problem with the brain, that this patient is having convulsion. You will know that it's breast cancer that has spread to the brain. Okay, if it has spread to the lungs, the patient can present with difficulty with breathing. There are times that breast cancer will spread to the lungs and it will start to produce water in the lung, what we call pleural effusion. And such a patient will find it very difficult to breathe. Some of them will be coughing, they will be having shortness of breath, and they will think that some of them will think that they have tuberculosis. Some will think that they have pneumonia. Some will think that they have respiratory problem, not knowing that
Mm.
it's breast cancer that they have that has spread to their lungs. Okay, for those in whom breast cancer has spread to the spinal cord, some may find it difficult to walk. They will be having a severe low back pain with paralysis. They don't know what's causing their paralysis. In fact, there was a time I was called to see a patient that had paralysis. When I got there, as I was discussing with the patient did not even volunteer the information that there was a swelling in her breast. It was when I was examining her that I noticed that there was a huge swelling in her breast. I just told her that this swelling in your breast is what is causing your paralysis. The husband told me, how? Doctor, how? I said, the swelling in your breast has spread to your backbone and it has affected your spinal cord, which has led to
Mm-mm.
this. At the end of the day, I said, come over to the hospital. They came to the hospital and we tested her. Of course, lo and behold, it was breast cancer that has already spread to the spinal cord. So that was how that it ended with her. So these are the nature of the patients that we see, the kind of patients that we see most times presenting with, symptoms of complications, symptoms of spread of the breast cancer itself. So it's not all the time that we actually see a patient come down with these features of the breast cancer. There are times some patients will come down with fissures of the
Late
part of the
stage.
body that cancer has already spread to. So there are times once we see something that may suggest another disease in another part of the body, we still look at the breast to see if it's the breast that has the problem that has sent signals to that part of the body. So basically, these are ways that we can actually use to say notice a patient that, or say a patient that has breast cancer. These are some of the ways that it can present, so that when a lady is experiencing some of these things, they will know that there may be something wrong with their breast and they will come to the hospital as soon as possible.
As soon as possible. If you are gaining value here, I need you to do me a favor. Share this video. Full stop. Don't do it. Don't do anything. Just share. Don't even comment. Share this video. Somebody in your network needs this information right now. So help somebody save a life. Share this video. Sir, I don't know if this scenario I want to paint is now common. A lady comes to the hospital, she has been diagnosed of breast cancer, and she says, no, I don't want your treatment. I will go home and go cure myself. What could happen in the long run to her? Have you seen cases like
Uh,
this? How do
we-
they end up?
yeah, we've seen a lot of cases like this,
Hmm.
that the ladies will come, you will say, this is breast cancer. Some of them will tell you that no, it's not breast cancer. And majority of them actually go back to their pastors, which is why at times I don't know, like in my church, for example, I've spoken to the women in my church about breast cancer before now, and my pastor is even aware that once a lady has something in the breast, that lady is supposed to come to the hospital immediately. But there are some of these pastors, when ladies have something in their breast and the ladies come to them, they will anoint the breast and tell the lady not to worry about it, that God will take care of it. What we do, God has a hand in what we do. I believe in the fact that whatever God cannot do does not exist. That is why when we are treating patients, for example, it's God that is still assisting us to treat patients. If, for example, we treat you and you get well, it's God that has done it. And you can also go back to your church and give that a testimony that I was treated and I am cured of breast cancer, for example. And we can actually use you to advocate for more ladies to present to the hospital as early as possible. Now, for those ladies that come to the hospital and we make a diagnosis of breast cancer and they end up not taking treatment and going back, the only thing, what happens normally is that by the time they are coming back to the hospital, they are coming with an advanced disease that may not have cure. Okay, like I said earlier on, that breast cancer, when we see it at the early stage, the goal of treatment is curative, is to cure the disease. But by the time a lady goes back home, for example, or goes to her pastor for prayers,
Hmm.
and they now wait for a prolonged duration of time before coming back to the hospital. They usually come with advanced disease. And as at the time they are coming to the hospital, there is little or nothing we can do at that point in time, rather than palliating them just to take care of their symptoms till they eventually die. Okay, so that is why if a patient comes to my clinic, for example, and I make a diagnosis of breast cancer, I take my time to counsel the patient very well. And I will tell the patient that, see, this breast cancer that you have is not a death sentence. Okay, and even if the patient comes early enough, I will tell the patient that you are not even going to lose your breast. I'm
Hmm.
going to remove the cancer and I will leave your breast for you. I will tell you that. Okay. But if the patient is coming quite late, then that patient will lose her breast. And I will still tell the patient that it's better you lose your breast than you lose your life. All right. And I
Mm,
also counsel the patient that if you fail to receive treatment and you decide to walk away, you will come back with a more advanced disease that we may not be able to do anything for you. So we have seen scenarios like that. So many of them that they will come to the hospital and they will tell you that they don't have breast cancer. At times, most of our patients are actually in denial. I don't know,
mm,
it's just the human side of things. Once you tell them that, madam, you have breast cancer, they will tell you that no, I don't have breast cancer. I know that I don't have breast cancer. I will never have breast cancer. I reject it in Jesus' name. These are some of the problems we face. These are some of the challenges we face in the management of breast cancer. Okay, there is a lot of spiritual undertone to this management of breast cancer that is making
yeah,
us to find it very challenging to
yeah.
treat breast cancer in our
Mm,
environment. Okay, so that is that. So I want to say that we have experienced quite a number of cases that patients will come to the hospital and they will refuse treatment and go back home only to come back with an advanced disease that we may not be able to cure again and we just palliate their symptoms, which is quite bad, especially in our environment.
very bad. So I'm looking at the time. I really don't want to keep you. I'm sincerely sorry, but my eyes are on the time here. Quickly about the treatment. You've been mentioning cure. I heard in the sentences cure, cure. Some people might not be aware. Is it possible that you can cure breast cancer? Or why I'm saying this, trying to relay the information I get online. What people say is, you doctors, you just want to treat the surface. You don't like to treat it and cure it so that they will be coming back to you so that you'll be making money from them. Is it possible to cure breast cancer?
All right, thank you. I want to state categorically that as doctors, as surgeons, we treat, but God heals. So we are not the ones that are curing cancer. It's God that is curing cancer. Ours is
Hmm.
to treat. All
Hmm.
right. So now, in to answer that question, I will say that the treatment of breast cancer depends on the stage of the breast cancer. Breast cancer has early stage. It also has late stage. For those people that are actually doing breast cancer screening, for example, those ladies that are doing breast self examination every month, if they notice something unusual about their breast and they decide to come to the hospital, chances are very high that they will have early stage breast cancer. But for those ladies that visit one spiritual home or the other before coming to the hospital, and they will have a lump in their breast for a very long period of time before coming to the hospital, chances
Hmm.
are very high that they will come with a late stage or an advanced breast cancer.
Hmm.
Okay, I've conducted studies in the past to actually study the presentation of breast cancer in our
Yes.
environment, and I found
Yes.
out that 90% of our patients are presenting late to the hospital. 90%, which means that it's only 10% that we see with early presentation. That was why I told you at the beginning that
Yes.
management of breast cancer here is very challenging because of
Hmm.
late presentation.
Late
All right.
presentation.
So now, when the patients present early, for example, if you can see a patient that is presenting early and the
Yes.
breast cancer is early, which means it's early stage, the,
Yes.
the aim of our treatment for such a patient is to cure the patient. Okay. And when we are treating patients with breast cancer, we have different treatment modalities. We
Yeah.
have surgery, we have use of drugs, what we call chemotherapy. They will also have the use of radiation, what we call radiotherapy. But the most important of this treatment in our environment is a multimodal treatment, which means that we devise all these treatment modalities. Okay, but the one we like emphasizing to the patient is surgery. All right, and in the surgery, I will still want to say it here, like that. My studies, one of my studies you were referring to earlier on, we actually
Yes.
look at the rate, the different surgeries that we do for breast cancer. I will notice that the rate at which we remove the breast is very high in our
Hmm.
environment. The
Hmm.
rates at which we remove the breast is very high. In fact, when I had an interaction with my friends in America, They were very angry that we are still removing breast in Africa. And I told them, I said, okay, no, first and foremost, let me show you some of the pictures of breast cancer that we have in our environment. Because it was like, Dr. Taga, I'm quite angry that at this stage in your life, you are still removing a lady's breast. You are not supposed to remove a lady's breast because of breast cancer. I expect
mm,
you to just remove the breast cancer and leave the lady's breast. Do you understand me? So I said,
yeah,
okay, let me just show you some of the pictures of the patients we see in our environment. I
yes.
sent them five pictures of some of our breast cancer patients. When they saw the pictures, they were begging me to delete the pictures. They could not look at the pictures. I said, this is what we face in our environment. Can you even touch
Wow.
this? Can you even remove this breast? Do you understand me?
Can you save this
Okay,
breast?
so you can't do anything about that breast. In fact, if they have not even seen that kind of breast cancer in their lives, they have not seen that kind of breast cancer in their lives. These are the kind of breast cancer we see in Nigeria because of late presentation. So the truth of the
Mm,
matter is, when the patient comes very early, chances are very high that we can salvage the breast and remove
mm,
only the cancer. We can remove only the cancer from the breast and leave the breast behind. This is what we call a breast conserving surgery, which is actually the gold standard now. That is what is being advocated. That is what is being preached. Do you understand me? If I tell a white man today, for example, that my patient came to me with breast cancer and I removed the breast, the white man will almost convulse because they are not used to removing breast anymore. Why? Because most of the patients that are coming to them are coming very early. And why are these
mm,
patients coming very early? They have screening facilities. They are screening their patients. If you
mm.
ask our ladies, for example, the ladies that are listening to us now, if you ask them, how many times have you had breast cancer screening? So we tell you that they've never had breast cancer screening in their lives before.
Can you
Do you
imagine?
understand me? But in the Western world, where patients go to the hospital for breast cancer screening, you know, if breast cancer is there, they will catch it very early and they will remove only the breast cancer and leave their breast behind. So removal of the breast is actually in one of our studies that we try to look at the factors that lead to late presentation. We actually identify that one of the factors is the fear of removal of the breast. Some of the ladies said they heard that once they come to the hospital, we'll remove their breast, which is not true. It's the fact that they are coming to the hospital late that is leading to removal of the breast. Do you understand me? So supposing they come to the hospital early and the breast cancer is at the early stage, we'll remove the breast. We'll remove the cancer and leave the breast behind. But if they are coming a little late, then we'll have to remove the breast. And if the breast cancer is early, and we are removing part of the breast that contains the cancer or the entire breast as the case may be, chances are very high that they will achieve cure. And those ones that usually achieve cure are the ones that will follow the treatment programs strictly. Like I mentioned before, there are various modalities of treatment. Surgery is one of the aspects of treatment. The use of drugs, the drugs we call them chemotherapy. There are some drugs that are hormonal drugs that we give to them, some of them. Then
Mm,
use of irradiation, what we call radiotherapy. Once these patients follow this treatment plan strictly, they will achieve cure. I can tell you that there are patients that we've treated for breast cancers 15 years ago that are still alive today. Those ones have achieved cure. But for those
mm,
patients that will present late, especially the ones that will come to the hospital with the where the breast cancer has already spread to other parts of the body, I can almost always tell you that those ones they have a very short period of time to live. The ones that will come to the hospital with the breast cancer having spread to the lungs, for example, or to the brain, most of the time when I speak to the relations of those patients, I will tell them that I'm not God. I cannot tell you when your person is going to die. But from my experience and from
mm,
the books that
mm,
I've read, I can tell you that your person will not last another 6 weeks. Your
mm,
person will not last another 1 month. In fact, just 2, 3 weeks ago, there was a lady that came from Lagos and she came with a very advanced breast cancer. I had to tell her younger brother that I think your sister has less than 2 weeks to live. He was dumbfounded, was looking at me. He said, Doctor, are you sure? I said, yes, I think she has less than 2 weeks. Of course, the lady lived another 1 week and died. She did not even live up to the 2 weeks. because she came with very advanced breast cancers. All right.
But
So
sir, people
yes,
get angry when they hear statements like this. When doctor tells them that this case is at the very least a terminal, this person has maybe 6 weeks, 2 weeks. The next thing you hear is, "You are not God. You don't own my
yeah,
life." Why?
yeah.
Why?
Yes, the thing is this: there are times that we prepare our patients' minds,
Hmm.
because if you don't prepare the patient's minds, some of them will be expecting miracles. Okay, based on science, based on experience, we understand some of the cause or the causes of some of these illnesses. So that is why when we see them at a particular stage, we can tell you that this person has limited time to live. We may not be accurate. There are times we'll tell you that this person has maybe less than a month to live. That person can actually still live another 3 months.
Hmm.
Okay, so we may be exaggerating at times, but the fact still remains that some of those patients that are presenting with delayed disease, they have limited time. Okay, so we may not be so exact or categorical about the duration of time, but to some extent we can guess the duration of the time that the patient has to live. And it actually makes some of these patients to come to terms with reality. You understand? Rather than just giving the patient false hope and giving the patient relations false hope, there are times we just tell them that this patient has limited time, that the patient is coming quite late. Likewise, those patients that are coming very early, we tell them categorically that you see this your cancer, we are going to treat it and you are going to achieve cure. Do you understand me? Because you are coming very early. So that is why we are advocating that women should come to the clinic when they notice anything in their breast as quick as possible, as early as possible, so that when they come to us, we will tell them that you see this your disease, we are going to assure you that you will achieve cure in this disease. I will treat you by the grace of God, you will achieve cure. Why for those ones that are coming so late, we'll still tell them that whatever we're going to do for you is just to manage your symptoms and palliate the symptoms. Because the essence of treatment at this point in time is to make the patient to die a painless death. Because as
Hmm.
doctors, we don't like it when our patients pass through pain. All
Yeah.
right. So we try
Yeah.
as much as possible to ameliorate their pain, to reduce their suffering, even though we know those patients are going to die. We still
Hmm.
try to make sure they die a
Pain,
pain-free death,
painful.
which is part of what we call palliative care. So we
Palliative
palliate
care.
those patients to make sure that even though their time, the time they have is limited, but they
Limited.
should not suffer. All right. So that is not the goal of treatment for those patients that have very advanced disease.
Thank you very much, sir. We're about
Yeah.
rounding up. If you are a woman listening to me, I want to ask you, and I need you to drop it in the comment section so that let's see. Have you gone for breast cancer screening before? And that leads me to my next question as we round up. Tell us more about breast cancer screening. At what age? Who should go for breast cancer screening? How frequent should a woman go for breast cancer screening? And then, if she goes for breast cancer screening and there is a problem, what would be the next line of action for her? What would you advise her to do?
All right. So the advice is for every lady that has attained puberty to start breast cancer screening. And there's a crude method that you can actually use to screen yourself, which is the breast self examination, wherein you can examine your breast at home once
Mm-hmm.
every month, on the third to fifth day after your menses. You do it every month so that whenever you notice any problem in your breast, you come over to the hospital to see us. Then any patient, any lady that has had a family member with breast cancer should come to the hospital to see us. And we'll now do another form of breast cancer screening, which we call the clinical breast examination. So you can actually screen yourself by examining yourself once in every month. Then when you come to us, we can actually still screen you too by examining your breast for you. And if
Mm-hmm.
we still suspect that there may be something in the breast, or somebody
Yes.
that has a risk factor for breast cancer, then we can now ask
Yes.
you to do a mammogram for us, which is a form of breast cancer screening. There are times that there may be something in the breast that we may not be able to pick, you may not be able to pick, but by the time we subject you to an imaging screening using either ultrasound scan or a mammogram, we should
Yes.
be able to pick if there's something there. And if we do a mammogram for you, for example, and there is nothing there, at least we know that there is nothing there, which means that later on you still repeat the mammogram. We always encourage women to, repeat mammogram. Once they get to the age of 40 years, we encourage them to do mammogram at least once in every 5 years. But for those ones that are at risk of having breast cancer, that have a very high risk, we will encourage them to do mammogram every year. Okay, so as for that question, who should screen for breast cancer? Any girl that is above the age of 20 should start screening for breast cancer. And every patient that has had a family member that come down with breast cancer before
Mm-hmm.
must, that lady must come to the hospital to have breast cancer screening. So the whole essence of screening for breast cancer is to catch it early, because as I've said before, that the outcome
Yes.
of breast cancer is very good when it's seen early, as compared to a poor outcome in patients that present with advanced breast cancer. So if you adhere to the different screening methods that I've made mention of, then the chances are there that even if you have breast cancer, you will come early, and the breast cancer will be at its early stage, and you will be one of those persons that will assure that our goal or your goal of treatment, or our goal of treatment, is to make sure you achieve cure.
Thank you, sir. There is a comment here, just briefly, about the misconceptions surrounding breast cancer. So many of them. I don't know how much you can help us. This guy says, if a guy sucks a lady's breast, can it cause? But I think it's wrong. Let's use the word, can it prevent? Because I've heard men say that we can suck to prevent breast. When we do this, we prevent our women from coming down with. I know you mentioned breastfeeding, but for the men who still hold on to this belief that if they suck as well, they can help their women prevent breast cancer. In addition to another misconception, I've heard as well that certain leaves our people eat can help them cure breast cancer. If you eat this leaf, or if you deprive your body of this food, it will cure breast cancer.
All right, for the first one, the first misconception is actually a misconception that if a lady's breast is soft, if you can prevent against breast cancer. The answer is no. When we are talking about suckling the lady's breast, we are talking about breastfeeding. Okay, lactating mothers, a
Hmm.
breast that is actively producing breast milk. All right, when a
Yes.
woman is breastfeeding a child, there is suppression of estrogen. I've explained this hormone, that this
Yes.
hormone, if a lady is exposed to this hormone for a prolonged duration of time,
Fine. Yes. Yes.
chances are high that she may have breast cancer. And during the period of breastfeeding, the hormone is suppressed. Okay, and it's this suppression of the hormone that actually protects the woman from having breast cancer. Okay, but if you are not a lactating mother that is actively breastfeeding a baby, no matter how someone sucks your breast, is not going to protect you from breast cancer. It is not going to protect you. So it is a misconception. When we talk about sucking the breast, is for breastfeeding mothers that are breastfeeding their babies. All right. Then as for the leaf, as for the food and all that, fine. There is no leaf that one will eat that will protect the person from having breast cancer. But as for food, we can always encourage you that you try as much as possible to watch the food you eat. Reduce excessive consumption of fatty food. Okay, because I've said at the beginning that obesity is one of the risk factors. Excess fat in the body is actually a risk factor for breast cancer. So if you can limit your intake of fatty food, it will be protective. The reason being that some of your excess fat can actually be converted to estrogen. All right. So any food that contains fat at all, you can limit the intake of fatty food. Once you do this and you try as much as possible to live a healthy lifestyle, then you will be protected to some extent from breast cancer. Like these things are not absolute, but to a
Yeah.
reasonable extent, you may actually get some protection from them. Yeah.
So please, before you go, somebody's asking, is there any way to reach out to you? And let me mention this in case you are just watching. Our guest is a consultant surgeon. and a lecturer at the ERA Specialist Teaching Hospital, Ekpoma, Edo State, Nigeria. So, in case you didn't get that in the beginning, but I don't know, sir. Is there any way there are people watching us outside of Nigeria? There are people watching us different parts of Nigeria. Is there any way anybody can reach out, or do they have to visit the hospital to see you?
Well, if they want to reach out to me personally, they can reach out to me on my Instagram page. I think you can display it for them.
Yeah.
My Instagram page or my Facebook page. You can reach out to me there. But I always advise listeners that when you experience anything in your breast, you should try and visit the doctor. If you are nearby, if you are in Edo State, for example, you can visit the Antigua Specialist Teaching Hospital. If you are in any other state in the country, there are very good hospitals around where you can see your doctor and they'll be able to sort you out. Once you notice anything in your breast, please visit the doctor. But another thing is that you must not notice something in your breast before you visit your doctor. I've mentioned
Mm,
factors. If you notice that you have some very high risk factors for breast cancer, please visit your doctor for screening, especially those ones that
mm,
have family relations and family members that have had breast cancer before. Please, you don't have to wait for it. Just visit your doctor and get yourself screened. And those of you that are, having one risk factor or the other, or you are not feeling too comfortable with your breast, please don't wait till it happens. Just visit your doctor, and your doctor will get you screened. It's always better to have yourself screened that will come down with the disease. Because, like the saying goes, that prevention is always better than cure. And I've talked
prevention.
about early diseases that they see in the Western world is as a result of screening. And the late diseases that we see in this part of the world is as a result of what? Lack of screening in our environment. Please try as much as possible to get yourself screened.
Try as much as possible to get yourself screened. Thank you very much. This is
Thank
where
you.
we draw the curtain. You've given advice to everybody watching us. What about what advice would you give to health workers? Sir, I know we've been talking to the patients, but we didn't. I don't know if you have anyone for health workers today. Is there anyone?
Of course, of course. Now, let me say this that we actually have, to some extent, we have problem with some health workers, despite the fact that they are very knowledgeable, they know about all these things, but they don't practice them. You know,
Hmm.
there is a study that I'm currently carrying out now among nurses. I'm trying to find out their knowledge of breast cancer screening methods.
Hmm.
So I've not completed the study, but I've started seeing that some of them actually do not practice these breast cancer screening methods. All right. So some of them have not even had mammogram. Some are 50 years of age and above, and they've not had a single mammogram before, a mammography before. Some don't practice breast self examination. Some have not been examined by doctors before. These are health workers. And these
Hmm.
are the same group of persons that you expect to actually create awareness to the general public. And we have our own experience here that some of these our fellow health workers that they don't practice this breast cancer screening method. So what you don't practice, how do you expect the person to preach it? So my
Hmm.
message to these health workers is that they should practice what they preach and try as much as possible to actually practice this breast cancer screening method.
Thank you very much for your time, sir. We'll draw the curtain
Thank
here.
you.
I want to
Thank
appeal to you watching. Do me a favor, please, so that Dr. Taga would not regret coming here. Share. I've gotten a lot of share, but I want you to share more so that people would benefit. Thank you very much for your time, sir. We really do appreciate what you do. We appreciate your sacrifice and other health workers taking care of patients in resource poor status settings like the one we have here. We want to say a very big thank you to you.
thank you. Thank you. Thank
Thank
you.
you very much for your time, sir, and have a
Thank
wonderful
you.
evening ahead, sir.
You too. All right.
Bye
Thank you
bye.
very much.